In many poor countries where there are competing priorities for scarce resources, vulnerable groups like orphans often suffer more than other vulnerable groups. In the presence of crises like the worldwide COVID-19 pandemic, the plight of orphans will often intensify. In the national plans for response to widespread disasters, orphans and their needs are often overlooked. This is often the case, even where the orphans are more deserving or more vulnerable than the other groups. This is also the case because in many countries there are special interest groups or organizations that exist to care for different populations which face similar challenges or suffer common vulnerabilities. For instance, in Malawi, there are associations that look after these who suffer from or live with HIV and AIDS. There are organizations that look after polio-challenged children, that look after cancer survivors, that look after persons with albinism. The list actually goes on and on. But sadly, there are no similar special interest groups that coordinate or take the responsibility of caring for orphans in Malawi during disasters like the current one. In situations of national crisis like COVID-19 pandemic, various vulnerable groups will be provided for in national response plans. There will often be funds earmarked for the needs of these vulnerable groups. In the COVID-19 response plan for Malawi, however, you'll find no section or even mention of orphans. The COVID-19 susceptible groups, like the elderly or those with pre-existing morbidities, such as diabetes, high blood pressure, asthma, healthcare workers, all these have targeted interventions in this national plan for COVID-19 prevention. The absence of orphans from the organized national response efforts gives the wrong impression that these orphans are not vulnerable. The economic impact of the pandemic greatly affects the welfare of any orphans anywhere in the world. The women and families that look after them are often poor. They need help to get food and to get other critical needs for the orphans whom they look after and for their own children. These are the hidden vulnerabilities of orphans regarding the impact of COVID-19 pandemic on their own care. The more ravaged the economy gets by COVID-19, the lower the government puts orphan care on their priority scales. We are fortunate in Malawi that the first wave of this pandemic was not as intense as we had feared. To date, for instance, the total number of COVID-19 cases in our country, which is about 17 million population, is only 34,200. Out of these, 32,176 recovered fully, and only about 1,159 have died so far. On 13th May this year, The total new cases was only 14 on that particular day. And actually 330,348 have been vaccinated. We are worried about the intensity of the next wave of COVID-19 attacks. This is because the possibility of infection by the Indian or South African strain exists in Malawi. There are people who recently traveled from these two countries and died of COVID-19 soon after they arrived in Malawi. This wave, therefore, will be more difficult for us to contain. Our orphan caregivers will therefore need more help, like medications, PPE, and food for the orphans and for their own children. Many parents and guardians are afraid actually of going to the hospital these days. They are afraid of contracting COVID-19 at the hospital once they get there. This fear is actually well-founded because the COVID-19 preventive measures are actually inadequate in many of our hospitals. Sadly, in the process, there are some children who succumb at home to preventable and curable illnesses. Worse still, when they steal away from the hospitals, they do little or nothing to comply with COVID-19 prevention measures at home. This is understandable because they cannot afford masks or even soap for the required frequent hand washing. The politicians, in fact, compound this problem further because they insist on conducting large campaign meetings during elections in the middle of a pandemic such as this one. These big gatherings will be big spreader events where the more virulent Indian and South African strains will hit us more and more. The challenges for our orphan care needs will become more complicated as they face stiffer competition. We will need to be more sensitive to the plight of orphan children in our midst as the intensity of the pandemic grows. Many of the orphans must not be left behind when these second surges get more challenging as the more virulent strains become more prevalent. This is more reason why we should establish the UN World Orphans Day. This will be a highly effective way of getting the world community to do something about the forgotten and silent groups of orphans, especially to help in the establishment of the UN World Orphans Day. Churches and other NGOs, government, and many other authorities should be mobilized via the UN organization and system to care for orphans around the areas of their jurisdictions and to highlight the need for national involvement in orphan care. Thank you very much.